Nice presentation. I didn't know some of those things about the assisted suicide. Learned a lot. Thanks.
Imagine lying in a hospital bed in severe pain and fatigue. Machines surrounding you beeping constantly. Nurses and doctors constantly coming and going to monitor your vitals. You can't sleep. You can't breathe on your own. And you can't eat without suffering from extreme nausea and vomiting. Your doctors are there to control your pain and make sure you're comfortable. When you are terminally ill, what does comfortable mean? Is it even possible? Not from a physical standpoint. However, drugs can numb your pain, but there's also a mental stress that comes with the terminal diagnosis. The stress is not just yours. The stress is shared by your friends and your family. There's little to no chance of survival. What would you do if you were given the opportunity to choose how your life was to end? The textbook definition of physician-assisted suicide is the suicide of a patient suffering from an incurable disease affected by the taking of lethal drugs provided by a doctor for this purpose. The debate on whether physician-assisted suicide should be legal throughout the United States has strong proponents on both sides of the argument. Some anti-proponents have tried to categorize physician-assisted suicide as euthanasia, which is defined by the act of assisting people with their death in order to end their suffering, but without the backing of a licensed doctor in controlling legal authority. I believe that when it is an informed decision made by the terminally ill, their doctors, and family, it provides a path for those who have a terminal illness to make the decision to die with dignity, without suffering. Currently, only 5 states in the United States allow legal physician-assisted suicide by state law: California, Oregon, Vermont, and Washington, and Montana has a physician-assisted suicide mandated by law as an option for patients. The specific method in each state varies, but it mainly involves a prescription from a licensed physician approved by the state by which the patient is a resident. Like patients, physician participation is voluntary. Even in those states where it is legal, there has not been a great wave of people seeking this option. For example, in Oregon, which has had an assisted suicide law on the books since 1997, statistics show that through 2015, 1,545 people were approved for this option, with only 991 deaths resulting from using prescribed medications. Why do patients choose this path, and why should it become a more widely available option? The diagnosis of an incurable disease can be devastating to the patient and their family. Many do not want to suffer through the pain or the indignity of being bedridden or to be a burden on their families. Surprisingly, it is this final point that weighs most heavily on people diagnosed with terminal illnesses. A survey conducted by the Boston Globe showed that the main reason people with an incurable illness who suffered a great deal of physical pain would consider ending their lives because they do not want to be a burden on their families. They were not primarily concerned with the pain or even a restricted lifestyle. Every day, there are thousands of people being diagnosed with illnesses such as cancer, supranuclear palsy, Lou Gehrig's disease or ALS, and Alzheimer's. Every day, some of these patients are making choices to take their own lives via other alternatives. Expansion of medically supervised or assisted options would provide options for those in need. Increasing availability does not increase the number of people dying from terminal illness. It provides an improved availability of counseling, more informed medical treatment, better end-of-life scenarios for those who may have chosen other means. This would also provide more transparency for the public which means more oversight and management by governing bodies. When an individual is diagnosed with a terminal illness and an option exists for a medical professional to assist the individual, then there needs to be an established process that includes a review of medical diagnosis, counseling for the individual and the family, a review by independent medical board, something along those lines that ensures that the decision being made is not just a rash decision. Personal needs of an individual need to be met prior to making the decision of assisted suicide. Needs such as an individual and family-oriented counseling to ensure that they understand the decision that they are making and the impact that it will have on their families. Discussion about the process that they are about to go through in case that there is an instance when the individual comes to the conclusion that they no longer want to go through with the process. November 1st, 2014. Brittany Maynard, a 29-year-old with a terminal brain cancer, ends her life under Oregon's Death with Dignity Act. She moved to Oregon following her January 1st, 2014 prognosis in order to take advantage of the Death with Dignity law. There is no such law in her native California. She garnered a large following advocating for physician-assisted suicide laws via social media. Would you rather know that your loved one not only made the decision to end their life in a peaceful manner, or that they ended their life in a more violent manner? Imagine. Someone is home alone. They are miserable, in severe pain, just contemplating how easy it would be to end their pain and suffering with a suicidal act that is violent, inhumane, and unaccepted by society and religions such as Christianity, where a person who commits suicide is no longer allowed to be buried in a Christian graveyard. Versus somebody with a loving family and a loving environment and is about to end their pain and suffering in a medically safe way, a humane way, that is medically approved and will be more accepted knowing that it's for a medical purpose. On October 5th, 2015, California Governor Jerry Brown signs into law the End of Life Option Act, which legalizes physician-assisted suicide for Californians with a terminal illness. A letter to members of the California State Assembly, Brown wrote that he thought about his own death while considering whether to sign the bill. He quoted, "I do not know what I would do if I were dying in a prolonged and excruciating pain. I am certain, however, that it would be a comfort to be able to consider the options afforded by this bill. I urge you to join support groups, talk to your loved ones, call your local senator and congressional representative. Let them know that physician-assisted suicide is a humane and a safe way to allow a loved one to be released from their pain and their suffering. Thank you."